Hello, I'm Dr. Robert LaLouche, your board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about painful periods, or dysmenorrhea. Unfortunately, cramps are a normal part of the menstrual cycle, but that doesn't mean we can't do something about them. If they're mild, you don't have to do anything about them, but if they are interfering with your life, if they're really uncomfortable, then I'm sure you're familiar with some of the over-the-counter preparations, and those are useful to try. I find that most patients get more relief with the non-steroidal anti-inflammatories like Advil, ibuprofen. And when you know that your period is coming, if you start taking it before the pain gets more significant, it can often help prevent the pain from occurring in the first place. So depending on your size, 2 Aleve to start, and then 1 twice a day, or 3 or 4 ibuprofen, the 200 milligram to start, and then 3 every 6 hours. Be careful, that's maximizing the dose. Look on the label, and that can irritate your throat and irritate your stomach if you don't have enough fluids with it. Don't take a pill while you're half asleep and take a little sip and let it slide through your throat. It's gonna really irritate your throat. But if you take the highest dose before your cramps really get bad, it can have an effect on the prostaglandins, which are actually causing the cramps in your uterus, and decrease the amount of discomfort you have, and do that for a few days, 2-3 days, and that can help. There is a stronger prescription medicine that works in the same manner but seems to increase the concentration in the uterus. It's called mefamic acid, or Ponstel is the brand name that's discontinued. Now that it's gone generic, it's a lot cheaper. It used to be about $1 a pill, pretty expensive. So that's an option for you to get from your physician. Also, if that's not working well, when I see patients, we often give birth control pills that decrease the intensity of the periods, the amount of cramping, the amount of flow. And if you look at the video I have, if that's really bad, you can even take continuous birth control pills that eliminate the period and could potentially eliminate all of your cramps. So there are some steps to go through, and if you're not doing well with just over-the-counter medicines, we encourage you to see your physician. There are things they can do to really diminish or almost eliminate the period cramps that you're experiencing. Not all of them are a normal part of the menstrual cycle. There can be things that are abnormal as you get older. Fibroids or non-cancerous tumors, there's another video on that. It's unlikely, virtually unheard of as a teenager, but the older you get, you can have fibroids that grow in the uterus and increase the cramping, or you can have polyps, a growth inside the lining of the uterus that can cause significant cramping, or you could have some narrowing of your cervix called cervical stenosis that can contribute. You may also be experiencing it as a result of a medicine you're having, or for example, some women have less periods but more cramping with an IUD, but most don't. Or you may have some cramping after an ablation where your bleeding is less, but you have some cramping, and if that really gets significant, that can be something called post-ablation syndrome. The point of this, I gave you a few examples are, you don't have to be suffering. If you are suffering, seek help. See your provider. They can decide what's occurring in your case and then give you a plan to help reduce this pretty significant discomfort. I hope you found these comments useful, and please leave comments of your own. Thank you.